In the clinical prediction rules, there's a test called the prone instability test. In this test, you do a PA pressure along the lower part of the lumbar spine, and this reproduces the patient's pain. Then you have them straighten their legs, and you do the PA pressure again, and it decreases their pain. If this is indeed the case, the theory is that in activating the lumbar spine musculature, it decreases the sensitivity of the area, so your stabilization program is going to have a greater chance of being successful. Although this does seem to work, it's hard because a lot of patients are not able to get into this position. So I propose a different position with the patient inside lying that we're going to review. When you're performing stability testing on a patient and you have them inside lying, what you want to do is fix the superior vertebra, put pressure through the line of the femur as long as you're below 70 degrees, and what this will do is bring the inferior vertebra backwards, which is a relative anterior shear. This is going to be important because when we did the prone instability testing, what we found is that if they activated the lumbar musculature, they had decreased pain. Now, as I said, a lot of patients can't get into that position. So what you can do is get them to a position, fix the top vertebra of the segment you think that needs stabilization, and you do your shear through the line of the femur. The patient says, "Ow, that hurts." Okay, well, there's a couple decisions you can make. You can ask the patient, "Can you do a Kegel exercise or tighten your core?" And then you have them and redo the testing. If they say, "Wow, that feels so much better," then that gives you a hint that Kegels and lumbar stabilization is going to be a component of your rehab program for them. And it proves to them when you do it that this is something that they should be doing more frequently. If that doesn't change their symptoms, you bring them up a little higher. Now this activates the thoracolumbar fascia now that we're at about 90 degrees or so. And you redo the testing again. The majority of patients will feel less pain in this position. That tells them that they have to do a pelvic tilt strategy in order to bring in their posterior ligamentous system and have decreased pain. Sometimes it takes this plus having the patient do a Kegel and redoing the testing for them to feel relief. So that is anterior shear testing.